But it is most certainly not a new one for President Obama. Back in 2004, then Illinois State Senator Barack Obama went toe-to-toe with our next guest over the state's health care reform plan.
It's pretty rare on the floor where a bill gets this mischaracterized repeatedly. It's pretty rare where that happens. Now, a couple of statements that were just made pretty quickly that we need to go over. Number one, Senator Roskam, you are well aware of the fact that that estimate of $3 to $6 billion had to do with if there was a state health care plan that was fully funded by government, and that had nothing to do with this bill as amended. You are aware of that. You got up there and you said that that's what the department said about this bill, and you know it's not true.
Joining us right now with his thoughts on the current health care bill is Congressman Peter Roskam, who is a member of the Ways and Means Committee. And good morning, sir. Thank you for joining us.
With you. Thank you.
That soundbite was part of a back and forth that you had when you and Barack Obama were both senators in the state of Illinois. But now you're kind of watching what's happening from a seat in the U.S. Congress. And what do you think about what's changed and what's stayed the same over this health care debate over the last 5 years?
Well, what stayed the same, it's really, I think, that 2004 debate was a foreshadowing of the way the president tends to argue. And he tends to argue that way when the facts aren't in his favor. If you play that whole tape, what's interesting is I laid out several criticisms of the president's initiative in the state Senate. And he didn't answer those criticisms. Instead, he said, well, I was mischaracterizing it. He said I was playing politics with it. But if you were able to listen to the whole 9 minutes, what you would notice is an absence of a substantive argument against it. So you fast forward now.
Well, what were your complaints at the time? What were the
two
facts
things. Number one,
and how can you make those facts applicable to today's health care situation?
Well, to go back to the 2004 debate, I was arguing that the Health Care Justice Act that Barack Obama was advocating was a prelude to a single-payer system, and that he was creating a scenario that the state of Illinois was the only entity that could possibly fulfill these requirements. Rather than saying, Roskam, you're wrong and here's why, he just chose not to do that. And he accused me of playing politics. He accused me of fear-mongering and essentially accused me of lying, which was pretty disappointing.
Well, what's your biggest concern about the health care plans that have been proposed today and have been working their way through the House and the Senate?
Well, the biggest concern is the so-called government option, because that is clearly a prelude to a single-payer system. When we were in the Ways and Means Committee, and you've got the director of the Congressional Budget Office coming in and saying millions of people are going to move from the private insurance market into the public insurance marketplace as a result of this. That's really the big obstacle. And the other piece is the price piece. When the president, with all due respect, says that this is going to bend the cost curve, and he's got the director of Office and Management and Budget, Director Arzog, saying that this is going to be a cost savings, and then you've got the CBO coming in and saying, look, this is going to cost anywhere between $1 trillion and $1.5 trillion. It just doesn't sync up with reality.
What would you do? What would you do if you were in his shoes?
Well, I would put together a different plan. I think ultimately there's a need for, there's an acknowledgement that the current system doesn't serve as many people as it should, and the costs are out of control. So there's a whole host of things that you can do as it relates to association health plans, tort reform, going after fraud within the Medicare system, which is as much as 10%. But I think ultimately what the president's got to do now, I think, is to pivot out of this sort of doctrinaire approach. And I think in order for him to pass something...
He may just do that. Jerry Seib points out in the Wall Street Journal that this is the point where he thinks, and Bob Dole thinks, has laid out an argument that President Obama needs to lay out what he would like to see in a bill, which he has not done to this point. Is there some... do you think he may be able to lay out a bill that you would agree with?
Well, it's my hope that he does. I think what the White House has got to make a decision is, do they abandon the political left in the House of Representatives and move towards the center and try and put together a consensus bill, or do they stick rigidly to sort of this liberal orthodoxy? And I think the left is going to be very difficult to satisfy, because they already feel as if they're bidding against themselves. Think about it. The left has said we are single-payer advocates, and they're coming out of the box, getting behind a government-run health insurance plan. If the president abandons that, he's got to, I don't think there's any way that he can satisfy the left on that issue. And that is the political trick bag that I think he's in right now. And the White House has to make a decision. Do they lower the goalposts and have some sort of win this fall? I personally think that's the smart move.
Can I just ask a question about this cost issue here? I heard a presentation on health care last week about how we end up paying for the uninsured. And that when they go and use different medical services, it ends up through a sort of complicated process whereby if somebody doesn't pay at a hospital, it ends up going back into all of our insurance rates. And so I'm just wondering if we're having the right sort of accounting here on a national level, Representative, when it comes to saying are we saving money or are we not saving money, that ultimately we all already pay for the uninsured.
Well, I think there's two things. Number one, the CBO looked at that and the totality of at least the Pelosi-Obama plan that was presented before the Ways and Means Committee.
But did the CBO include this idea that in some other way everybody who has insurance is paying for everybody who doesn't?
Well, let me answer that. So you got 47 million uninsured that we're told almost as consistently as anything that there's 47 million uninsured. When you scrub that number down, though, you find out that about 10 million of them are here illegally. About 5 million are ages 21 to 25 who, with a few changes in the insurance law, could easily be on their parents' coverage. Another 5 million are comparatively young workers that are just making the economic decision not to pay an insurance premium because they'd rather use the money and go to Cancun. They're making an economic decision. When you break it all down, million people who really, I think you and I and everybody that's watching today would agree are the folks that desperately need our help. Well, my attitude is let's focus in on the 10 million. Let's not be pursuing a fictitious 47 million, but we can develop a consensus to go after and support those 10 million. And I think that's where the action is ultimately.
Would you be in favor of something like the co-ops that the Senate's been talking about?
Well, I think the co-ops right now is sort of an idea that the details of which has been written on a Post-it note. There's no details on this. And I am very leery of sort of recasting and rebranding the government health insurance program and just giving it a new name and sort of a new bumper sticker and calling it a co-op. So until you really go through the details with me, I'm not necessarily convinced that that is all that it purports to be.
How do you think we would get coverage for an additional 10 million people like you talked about?
Well, you could do it a couple of ways. Number one, take my state, for example. The state of Illinois has a program called CHIP, not the S-CHIP program for children, but a catastrophic health insurance program that is part state subsidy and part participation on the part of users. You could expand that catastrophic coverage program just through normal state grants. You can also do things as it relates to advanceable tax credits and giving folks the ability to get money up front and then ultimately going out and buying insurance on their own on the marketplace.
But isn't the problem for people who are not looking to necessarily get tax credits because maybe they're not paying a lot in taxes right now? And then the idea of states picking up a lot of these through state grants, states are in a position where they don't have a lot of money to go around.
Well, I'm not saying that you would have that it's without any sort of cost. But
right.
What I am saying is you don't have to spend $1.5 trillion to get this done.
Congressman, are there any good ideas? You've talked about expanding coverage, but are there any good ideas to bring costs down? That is, all of the long-term fiscal forecasts are that we have tremendous deficits coming down the pike. A lot of it is related to health care. Is there anything we can do to bring down those deficits in the out years?
I think there's two things. One is you've got to take on somehow, in some fashion, you've got to take on a tort liability challenge. That is, the cost of defensive medicine, I think, takes most people's breath away. And if you talk to physicians, as I'm sure you know, they're weary of the number of tests that they have to prescribe in order to defend themselves as potential defendants in the future. So even if we're not able to agree with the president on caps on non-economic damages, for example, there are some things like creating a safe harbor law that says if you go through and do A, B, C, D, and E, by definition, doctor, you're not going to be a defendant in a lawsuit. Or some medical liability courts, states like Indiana that have used them, have brought down medical malpractice claims. That's number one. The other piece is to really focus in on the fraud component of this. And this is where Medicare is an antiquated system. Medicare has a pay first, then chase the money down system. We pay money out, then we hire investigators to go chase it down. Why not change that model? I offered an amendment in the Ways and Means Committee which would have set money aside to tell the Secretary of HHS to begin to use a point of sale sort of model, like we use in credit cards. The estimates are as high as 10% of Medicare is fraudulent. And I'm not talking about a little old lady that's overutilizing something.
Right.
I'm talking about a criminal enterprise. And the news media is just full of stories about criminals that are ripping off the system.
Right, Congressman, obviously it's going to be a topic of much debate. We appreciate your time this morning. Thank you for joining us.
Thank you.